Hi, everyone. Thanks for coming today to our diabetes class. This is going to be a little bit different than what we usually do, so hopefully the information will be translated to you in the same way. My name is Lisa Murray. I am the pharmacist here at the Stratford Family Health Team, and along with Kim Toohey, who you will meet for the second half of the class. She is our dietitian, and we are going to present our healthy living strategies for diabetes prevention and management. So today is really just an information class for all of you to allow you just to get a bit of information on what is going on in the body. So my portion is more, we're going to talk a little bit about some of the numbers that are associated with diabetes, but also what's going on in the body. So what can I do to make changes in my body? And that's what our goal is today, is to come up with some sort of plan that isn't overwhelming, to make some changes, but also just to look at the information and make sure you're understanding what is going on so you can put those changes into place. So the main reason you're here today is that your blood sugar is elevated. So again, higher than what we would normally like to see for your age. And there are certain targets or numbers that are standards that we like to keep the sugar below, and that is to reduce the risk of complications from happening. So most of you have probably had what you're called your A1C done. And that is the number that we use most often to diagnose diabetes, because it is a number that gives us an idea of what's been going on in your body for at least the last 3 months. So an A1C looks at how much sugar is attached to the red blood cells that are circulating in your bloodstream. So the red blood cells will last about 90 to 100 days in our bloodstream. They're sort of sticky. They kind of remind me of chewing gum. Things like to stick to it. So broken down cells, guck in the bloodstream, but also the sugar that's circulating in the bloodstream. And for somebody who has diabetes, they have more sugar in the bloodstream than we would like to see. And because of that, when we draw your blood, so when you go to the lab and they draw your blood and they spin the sugar off of the red blood cells, the concentration of sugar in the sample is what gives us our A1C level. So for anybody whose A1C is less than 6, that would be considered normal blood sugar. And again, you may not know these numbers. Normally in class, we would give you a sheet that explained this information. So if anybody is interested in that information, you are more than welcome to contact us here. You can contact me at LMURRAY at S as in Sam, F as in Frank, H as in Harry, T as in Tom, .on.ca if you want any of these numbers, especially now when you're not in the doctor's office as often. It just gives you a little bit of an idea about what's going on. So an A1C of less than 6, normal blood sugars. An A1C of 6 to 6.4 would be what we call prediabetes. Sugars are not in the type 2 diabetic range at this point, but they are climbing and we want to keep an eye on them. If an A1C is 6.5 or greater, then you have the diagnosis of type 2 diabetes. So type 2 diabetes, we're going to talk about in a bit, you are still making insulin in your pancreas. So a type 1 diabetic is somebody who no longer produces any insulin. The pancreas is not functioning. And because of that, they have to be on insulin lifelong. In type 2 diabetes, and we'll talk about different medications in a bit, we do use insulin, but it's not the only thing we use, and we use it in conjunction with other oral medications because your body is still producing insulin. So it's not that it has stopped completely, and that's the difference between type 2 and type 1. Type 2 is what we see as we age in most cases. So usually as we become less active, eating habits may not be the best. We're putting on some weight. That's when we start to see type 2 diabetes. So again, an A1C of greater than 6.5. So whether your A1C is in the pre-diabetic or the diabetic range, we're going to want to make changes to our lifestyle in either case. So the number is just a number, but it really isn't that important. Don't get hung up on that number. If your A1C is greater than 6.5, our goal is to keep it below 7. And again, we're looking at long-term complications. We want to prevent those. So if we can keep it below 7, whether it's with diet and exercise or with medications or a combination of both things, we do that. So a couple other blood tests you might have had done. A random blood test is you just go into the lab at any point in the day, you haven't fasted. That as well, we can use that number to determine whether you are pre-diabetic or diabetic. We can also do a fasting blood sugar, which is I haven't had anything to eat from midnight the night before, and then have our blood testing done. And those two, there are targets for prediabetes and diabetes in those as well. And the last is an oral glucose tolerance test. So not everybody will have done that. It's when you go to the lab and you have to drink that orange syrupy, almost like the McDonald's drink. And what they do is they check your blood sugar 2 hours after to see how the body is incorporating that sugar. Again, you can determine diabetes from any of those 3 tests. But I like when you have an A1C, and most of you will have that. You may not have any of those other numbers, so not a concern. But with the A1C, that is where we get the best result, again, over the last 3 months at least, as to what is going on in your body. So blood sugar is one thing. So when our blood sugar starts to elevate, our blood gets thicker. And it's a little harder to pump it through the blood vessels. So we also have to look at anything else that might impede or slow the flow of blood in the blood vessels. So we also look at what your cholesterol level is. And again, we can go over that. You can talk to the doctor or you can email me. We can go through that as well. And we also look at your blood pressure. And why do we look at those two? Well, cholesterol is going to guck up the arteries. It's going to get in the way. It's like globules of fat in the way of the blood. If our blood is already a little bit thicker and harder to move, and then we add stuff in the way, it makes it much more difficult to allow the blood to flow freely. So we do look at lowering cholesterol. How do we do that? Again, activity is going to help that. Changes in how you're eating. And that's where Kim plays an amazing role in this, helping you change some of those eating habits. Activity is fantastic, but in some cases, we need medications. So those are the drugs that are called the statins. So things like atorvastatin, rosuvastatin, pravastatin. What those drugs do is to help lower the amount of cholesterol that is in our blood vessels. It also helps to decrease some inflammation in the blood vessels by getting rid of that guck on the walls or in the vessel itself. So what the numbers we are looking at are a few. We look at your LDL, which is the stuff that gucks up or builds up in the arteries. So that is the major thing we are looking at. We want everybody's LDL less than 2. Your HDL is the good cholesterol. So that is the cholesterol that helps to get rid of some of that guck in the blood vessels. For everybody, we want that 1.2 or above. The other thing are triglycerides. So triglycerides are a form of fat that actually thicken the blood. So if your blood is already somewhat thickened because of higher sugars, we want to keep this down. So if you're pre-diabetic, we like to see a triglyceride level of about 1.7 or less. So pre-diabetic, not diabetic. In a diabetic, we like them less than 1.5. So the cholesterol medications can help with all of these things. So a lot of times we say diet and exercise for about 6 months, a year at the most. But if that's not helping bring the sugars down, then we really need to look at changing what we're doing, and that may be medication being added on. The last thing we focus on or look at is our blood pressure. And again, as our blood pressure elevates, the blood vessel starts to decrease in diameter. So it shrinks in size, so there is less space for that blood to flow through. So again, we've got guck in the way if we've got high cholesterol. As our blood sugar elevates, we tend to have thicker blood. And if the vessels are smaller or it's harder to get things through, if it takes more force to pump that thickened blood through, it's going to elevate your blood pressure. And again, we'll talk about what that does when we talk about complications a few slides later. So a lot of people may be on a fluid pill, something like hydrochlorothiazide, or a blood pressure pill that ends in pril. So perindopril, ramipril, enalapril. A lot of those medications are for blood pressure to open up the vessel. There's also ones that end in artin, like irbesartan, valsartan, candesartan. And what those do is they help to relax the blood vessels, open them up, lower the blood pressure and the workload on the heart. So if you are a diabetic, a type 2 diabetic, and your A1C is over 6.5, we like your blood pressure 130 over 80 or lower. If your A1C is 6.4 or less, a blood pressure of 140 over 90 is fine. And again, lower is good as well. So this is my favorite slide. What can we do and what can't we do? We can't pick our family, unfortunately. Genetics play a huge role in how likely we are to have a condition. So we can't change a family history of diabetes or high blood pressure or heart disease or high cholesterol. Those things may mean we're going to be on medications sooner rather than later. You can't change being over 40. So as we age, again, everything, think of a heart, the pancreas, those things are like pumps. And when they've been working for a longer period of time, what happens then is they maybe don't work as well if they haven't been maintained, like a motor in a car. So again, over time, and so as we get older than 40, that pump's been working longer. And that may be one of the reasons why it's not working as well. What can we change though? And this is the slide, this is the important thing. Through diet, exercise, and or medication, we can change our blood pressure, our cholesterol levels, and our blood sugar. We can absolutely change our activity levels, how we're eating and what we're eating. And I want to talk to you about modifying our stress, trying to find ways to control our stress. Now, so when we look at blood sugars being elevated, as I said, there's things going on in the body. We talked about the pancreas maybe not producing enough insulin, but the other thing that can happen is our muscle tissue becomes less resistant. So what does this mean? Basically what that means is we are not getting the signal to our muscle to open up. The sugar in the bloodstream needs to go somewhere. It needs to go into our muscle tissue, and that helps give us energy to fuel our body and keep our body moving. If that doesn't happen, the muscle tissue doesn't have the reserve it needs. The sugar in the bloodstream will elevate. And what the body does then is it says, I'm not getting enough sugar. So the liver starts to pump more sugar out into the bloodstream, thinking that's the problem. Maybe we haven't eaten. Maybe we don't have those carbohydrates changed to sugar to be able to allow us to do the activity. What happens then is our muscle still isn't opening and our sugars are getting higher and higher and higher in our bloodstream. So for some people, that poor pancreas has been overworked. It's been producing more insulin to get the signal across to the muscle, and it's tiring out. So we're maybe not pumping out quite enough insulin to say the insulin signal the muscle to open up. What happens in a lot of people is what we call tissue resistance or muscle resistance. And that is when our muscle just isn't getting it. It's not getting the signal from the insulin in the bloodstream. And why is that? The reason is a layer of fat in front of the muscle. So if there's fat in front of our muscle, it's like an insulation basically. It stops the muscle from getting the signal. So what happens is the pancreas is pumping out more and more and more insulin over time to try to get the muscle to open up. So when the doctor says, gotta lose some weight, what we really want to do is we want to be active. We want to try to reduce or decrease that fat layer around the tissue, the muscle tissue, so that the muscle tissue will open up. So some people maybe aren't pumping out enough insulin. Some people maybe have some tissue resistance at this point in time. So muscle tissue isn't opening up. So we're not getting the sugar into the muscle and the liver is pumping out more sugar to sort of compensate for that. In a lot of cases, it's a combination of both. So more than one thing going on, a combination of the two. And that's why we have a number of different medications, unfortunately, we have to use. So this is just a picture, basically a very, very basic picture. Sugar is the S molecules in the bloodstream. They're trying to get into the muscle tissue. So the insulin has said, hey, there's sugar in the bloodstream. We got to move it to the muscle tissue because otherwise it just sits here. It's not doing us any good. That fence is like the layer of fat. So maybe the muscle tissue is opening. Maybe it's not. but the signal isn't getting to that muscle. And when that happens, we simply have more and more sugar in the bloodstream. For a lot of people, what they say is, I'm really tired. So when the blood is thicker, the sugar is higher. A lot of times you find that your energy level is down. And again, what we want to do is find ways to move, to get active, to help open up that muscle tissue. Muscle tissue, no matter where you are, what you're doing, you get active, muscle tissue will open up when you get active. When muscle tissue opens up like that, that allows that sugar to move from bloodstream into muscle tissue. So no matter what we're doing for the rest of our lives, activity is a very vital part of getting that muscle tissue to open up for us. And that is why we suggest finding something you can do. And I'll talk about that a bit later. What can we do to be active? So a slide I really like is the complications. And again, not that I like the complications, but this is what our goal is to prevent these. That's why we're checking the sugars. That's why we're starting medications earlier. That's why we're getting you to be active. That's why you're at this class. Let's come up with ways that we can make changes so that we don't end up with the complications. So we look at the big vessels, the heart and the brain. Those are very large vessels, again, but really, really high complications. So increased risk of heart attack and stroke, 2 to 3 times the normal population with diabetes uncontrolled. Again, diabetes that is in a type 2 diabetic, we like to keep our sugars under 7 if we can. Now in elderly, we relax that a little bit. But again, sugars that are not controlled, the concern is we've got an increased risk of heart attack and stroke. What I worry about more in the short term, because a lot of you are here as pre-diabetics, and this is the first time you've had any information on this. What I look at in the short term are the tiny vessels, and that's what we're going to focus on really, is the vessels in the eye, the vessels in the feet. So tiny vessels in the feet, again, we talk about neuropathy or nerve damage because those vessels are not getting oxygenated blood perfused. And then the kidneys. The kidneys are my favorite. I mean, being a pharmacist, it is something that is a filter house. So a lot of medications are filtered through the feces, through the liver, but a large number are filtered through the kidneys. And again, it not only filters waste, but it filters drugs and byproducts of the drugs. So all of these areas are areas that we need to look at and be concerned about. So for the kidneys, I have a lot of people who say, well, my blood pressure is fine. Why am I on a blood pressure pill? One of those Prels or the fluid pills or the sartans. Again, it's to open up the small blood vessels. So your blood pressure might be fine, but our concern is those tiny, tiny vessels in the eye, in the kidney, and in the feet. We want to keep them open. So even if our blood sugars are elevated, we're able to perfuse those areas. What happens is small vessels and vessels farthest from the heart. So in that case, we're looking, the feet is what I'm talking about. The small vessels in the eyes, kidneys and feet, all of those. The smallest vessels are the first ones to get the least oxygenated blood perfusion. Again, if our pressure's up, the vessels get narrower. If our cholesterol's up, there's more guck in the vessels. If our blood sugar is elevated, unfortunately, then we have much thicker and harder to move blood. And those little vessels don't get the perfusion. So my concern short term is those areas. Leading cause of blindness over 65 is from non-controlled type 2 diabetes. So anybody who is diabetic, A1C over 6.5, please have your eyes checked yearly by your doctor. They can look at the retina, see if any damage is occurring at the retinal level. The feet, I always feel, make sure you're checking your feet because neuropathy and nerve damage can present as burning, tingling pain, but also as numbness or lack of feeling. Check your feet. Make sure they're moisturized. Have someone cut your nails if you have difficulty doing that. And that way we can prevent something going into the foot that we don't know about. Because unfortunately, if our sugars are higher, our risk of infections is higher and healing is much slower. And if something's on your hand, you probably see it. But something on the bottom of the foot with no feeling is very difficult to see. For the kidneys as well, as I said, it helps to filter out our waste. But it also helps to filter out medications. And a lot of times, if people are having side effects, we lower the drug automatically. So possibly if the kidneys are functioning well, those vessels are open, then we may be able to filter the waste product or the drug out easier. And by doing that, it may minimize side effects in some people or allow us to stay on a medication that we maybe weren't tolerating. So again, it's more so the complications down the road. Probably by the time sugars are elevated to a type 2 diabetic level of 6.5, probably 7 to 10 years, the sugars have been elevating slowly over time. The concern is we don't want to see complications. We want to live long and we want to live healthy. So again, we talked about the heart. The increased risk of a cardiovascular event is 2 to 3 times higher in a diabetic. The other thing I always recommend to people is make sure you're getting your teeth checked because gum disease is more prevalent as the A1C increases, and it causes inflammation between the teeth and the gums, and that can affect the whole vascular system. So the blood vessels, the heart, all of the system, the kidneys, all of the organs. So making sure that is being checked regularly. Again, tiny vessels are our main concern. So that's why potentially blood pressure medications, diabetic medications for sugar, and cholesterol medications are being started earlier than in yourself, than potentially a parent or a grandparent. Again, we can't pick our family, so genetics does play a role for some people in having to start medications much earlier than somebody else their age. So my overall goal, if you take nothing else away from this presentation, my overall goal is to let you know that we want to reduce your A1C no matter where it is. If we can reduce your A1C by 1%, so say it's 7.2, we get it down to 6.2. Over time, not me, I'm not really doing anything for you. You get it down to 6.2. If you can decrease your A1C by 1%, that decreases the risk of complications in the small vessels, so microvascular vessels, the eyes, the kidneys, and the feet by 40%. To me, that's huge. That's my goal. My goal is to get your sugars down and to get you feeling better and decreasing your complications. So not everybody that's pre-diabetic will go on to become diabetic, but I think some people feel that they've done something wrong if that does indeed happen. So what I say to people is, if your A1C right now is 5 to 5.5, your 5-year progression to diabetes or an A1C over 6.5 is probably about 10%. If your A1C right now is 5.5 to 6, your risk of progression is about 25%. Anybody with an A1C of 6 to 6.4, there's a 50% chance that you are going to become type 2 diabetic. Again, it's crossing a number, maybe a 0.1 cross. So the goal is we want to look after our body, maintain it well, reduce our complications. Don't get hung up on a number because the numbers, unfortunately, are standards that are set. Blood pressure has numbers, cholesterol has numbers, diabetes, blood sugars have numbers. It feels like a whole lot of stuff you're being graded on at this point. It is a guideline. And so what I say to people is, let's just slowly work to decrease it. I'm going to talk a little bit about medication. I'm not going to go through a whole lot because some people are not on anything. I just want to let people know that there's a number of classes of oral medications. And then we have insulin in an injectable form, but we also have other agents that are injectable. Again, insulin has started much earlier now than we used to. We usually, before it would be, you've tried everything else, we'll put you on insulin. When I graduated from university in the 80s, insulin was a last-ditch attempt to bring blood sugars down. Now we may have patients on 1, maybe 2 oral medications and say, let's start insulin. Because if your pancreas isn't pumping out enough insulin, we've got to find a way to put that insulin in the body because we need that insulin signal to open up our muscle tissue. So the first category of medication that most people will probably be on is called metformin. What metformin does, it along with exercise are the only 2 things that help to open your muscle tissue. So it helps increase your muscle sensitivity. So even if your pancreas isn't pumping out enough insulin, the metformin will help the muscle tissue open when it's supposed to. So you take it with your breakfast and your supper. Basically, when you're eating, it helps to transport that sugar over. There is no low blood sugars with metformin because it's not making you pump more insulin out of the pancreas, and no weight gain, which is kind of nice when you're starting on it. If anybody is on metformin, I would recommend you taking a vitamin B12 supplement, about 500 micrograms a day. Metformin stops your body from being able to produce the vitamin B12. So it is something that I do recommend everybody be on. So that's muscle sensitivity or muscle tissue. Then there are agents that help you pump more insulin out of your pancreas. So these are drugs like glycoside or glyburide. And basically what these do is they make the make the pancreas more efficient. So it says, okay, come on, we got to pump a little bit more insulin out. So the body just thinks it's doing a fantastic job at that point. Anytime you put insulin into the body or cause a pancreas to pump more insulin out, you can get a low blood sugar. So this is where you need to start checking your blood sugars. And I'll go through a little bit about meters in a few slides from now. Then there's a category of drugs called DPP-4 inhibitors, and there's no quiz on these names. I just want to let you know that there's a lot of options out there. So everybody's going to have different drugs they're on. So the ones that you've probably heard of or maybe on are Januvia or Tradjenta. So what the DPP-4 does is it removes incretins from our body. And incretins help trigger the insulin release. So a DPP-4 inhibitor stops the enzyme that breaks down insulin. So it allows the insulin to stay in the bloodstream a little bit longer. And again, longer the insulin circulating, the longer the muscle tissue stays open, longer time we have to move sugar from bloodstream into the muscle tissue and lower our sugars. So our A1C technically will lower as we do these things. Again, very little risk of hypoglycemia or low blood sugars or weight gain with the DPP-4 inhibitors. So if you're on metformin and a DPP-4 inhibitor, there's nothing causing insulin pumped out of the pancreas. So again, you can check your blood sugars if you want, but you don't have to. And then there's another category of drugs called SGLT2 inhibitors. These are Invokana and Jardiance. So some of you may be on these. And what these basically do is they help you pee out more sugar from the bloodstream. So it's not actually getting into the bloodstream. Not out of the bloodstream. Pee more sugar out of the urine is what it will do for you. So it's not actually getting into the bloodstream. That can help lower the A1C levels dramatically. Tiny risk of low blood sugars, but it definitely can help with some weight loss. And it definitely, in some people, can help lower blood pressure. Again, we want to have the combination of blood pressure, sugar, and cholesterol looked after. So there's two classes of injectable products. The one class that is not insulin is called a GLP-1 agonist. So years ago, we would use things like Victoza and Byetta, and Trulicity then came on the market, but now we're using Ozempic quite a bit. And it's a once a week injection. And so what GLP-1 is, it is a peptide, or it's a product that is in our body that is released into the body shortly after we start eating. So basically you start getting the body will release that into the bloodstream. And what this does is a couple of things. It helps to lower your blood sugars by stopping glucagon secretion from the liver. So again, that liver pumping out more sugar. So it stops that from happening a little bit. And it helps with the pancreas from pumping out the excess. So we're getting less insulin, less glucagon in the bloodstream. So basically it is something that just is sort of helping to maintain and allow the body to function without increased sugar being put into the system. Then we have insulin. So again, there's short acting, there's long acting. A lot of times we start you on a long acting or a basal insulin at bedtime. Again, just to help get those sugars down, because a lot of times we're having you check in the morning. So we want to see where those sugars are first thing in the morning in a lot of people. And this just helps overnight, where my body, it would be pumping out that bit of basal insulin all the time. Yours may not be doing it as efficiently. So it's, again, putting insulin in the system so the insulin can be used to transport the sugar out of the bloodstream. Again, some people, their pancreas is pumping out insulin, but not enough. And this just adds to it again. So if you are adding insulin into the body, if you are on insulin, you do need to check your blood sugars with the long-acting or basal insulin. So things like Triceba and Lantus and Levemir, those ones, checking in the morning. Again, because it's basal, there's not a big surge in the amount of insulin. If you're taking insulin at mealtime, you really should check your blood sugars with each meal for a couple reasons. To decide how much insulin you're going to be giving yourself, and to know sort of what is going on in the body with the food and the insulin you are using. Again, to prevent those low blood sugars. So we don't want to see the low blood sugars, so more checking is something that we're seeing. The wonderful thing that is out there now, and I'm sure a lot of you know somebody who's using a Freestyle Libre, which is the monitor that you can check your sugars by putting a little disc on the arm and then swiping the meter over that. So you're not having to prick your finger all the time anymore. And again, for people who are maybe doing 4 tests or 5 tests a day, that's absolutely a great idea. Your fingers are, well, thank you immensely. But people who are checking less often than that, you could use one of the meters that you can get at the pharmacy. So I have some here as well. So if down the road you say, hey, you know what, I would like to start checking my blood sugars, or the doctor would like you start checking your blood sugars, you can do a couple things. You can go into the pharmacy and pick it up, and they can show you how to use it. You can call me, and I can set up an appointment with you, and we can show you how to use it. I've got some meters here. I don't have all of them, but I have a good selection here. And from those monitors, you can then, we'll go through it in the office, and then you take it home and you can use it there. Again, normally we'd have you checking first thing in the morning to see where those sugars are starting, and maybe a couple hours after meals. Again, it takes about 2 hours from the time you eat to the time that sugar is moved from the bloodstream into the muscle tissue. So we really want to see how your sugars are before a meal, but also what's going on in that body in those 2 hours after you eat. And that's where we can, the muscle insensitivity or the muscle resistance, we can see what's going on there. Because if it's not opening up, then the sugar in the bloodstream is not going to be able to move over in that 2 hour time frame. So again, doctor can just write you a prescription for meter and Lancets. It's covered by, the strips are covered to a certain percentage based on your medications, by drug plans, and by the over 65 plan. Lancets are the things you prick your fingers with, are not covered on the over 65 plan, unfortunately. They're not super expensive, but they are something you would have to pay for when you get those. So a bit about physical activity. Moving is important. Moving is important. Basically, it opens up the muscle tissue, which is one of the biggest things that it does, which is fantastic. And then opening up the muscle tissue, it allows us to move sugar from bloodstream into muscle tissue. There's also the benefits. We feel better. We have more energy. Again, regular physical activity, it improves your body's sensitivity to that insulin, and it will help lower those sugars. It can also help lower your cholesterol and your blood pressure. And those are our big 3, right? Those are the things we want to lower. Again, modifiable risks. We can help decrease some of them. And this is where activity has to become some part of your life that you continue doing to maintain or increase your level of health. So the Canadian Diabetic Association says to get 150 minutes of exercise a week, which is daunting. It's 5 30-minute sessions, which is a whole lot. But again, that's a guideline. Just get up and get moving. Walking, running, swimming, yoga, whatever you like. Get yourself up and moving. Get the heart pumping. Get the sugar in the bloodstream moved to the muscle tissue. So alcohol as well. Alcohol, especially the beers and the sweet wines, will contain considerable carbohydrates, and that can increase your blood sugars. What I find a lot of times is when we're drinking, sometimes we're not making the best food choices, and that as well can affect our blood sugars. So again, if we're drinking, we need to factor that into the fact that that is going to elevate our blood sugars. And so do we do something different? Do we watch what we're eating? And Kim will talk to you about these sorts of things. Or do we maybe get out and get more active to help? We would like to have that drink with dinner. So let's get out and get more active. Maybe look at a lower calorie option. Again, if this is something you enjoy doing, you continue doing it, but maybe modify it in some respect just to be conscious and aware that it will increase blood sugars and that may have a detrimental effect on the overall body. Really quickly, I'm just going to go over, if anybody is a smoker, we do have programs available at the Stratford Family Health Team that where you can get up to 6 months of free nicotine replacement product per calendar year. You'd come and visit one of our nurses here and they would go through the options for you. And why I talk about that is when your blood sugar is elevated, smoking can dramatically increase the damage to the blood vessels. They basically make the blood vessels kind of hard, so they don't have that elastic give. So when the heart is pumping and the blood is being pumped out of the heart, there's a bit of expansion and contraction in those vessels. When we're smoking, they become more friable or more hard. They don't open the way they normally would. So it's almost more like a concrete pipe versus a garden hose. I mean, I know there's terrible analogies, but it does decrease the diameter as well as the contractibility of those vessels. And that can increase those long-term complications. So heart issues, issues with the brain, the eyes, the kidneys, and the feet. It's what we used to call hardening of the arteries, basically. The arteries get hard. It is harder to pump the blood around. It is harder to get the oxygenated blood to those small vessels. So again, that is an option for you. You can come and talk to one of the nurses. It is always something that is here. You do not need a referral from the doctor. You can self-refer yourself to our phone, to our number, which will be on the presentation, but our phone number here is 519-273-7017. As well, I put our website on one of our slides, and that will give you all the information as well of all the programs and who you can contact. So I said I wanted to talk a bit about stress, and stress is one of those things that can increase blood sugar. So I worry about long-term stress. So something that happens this morning that you get fixed by the afternoon, I'm not really worried about that too much. I'm worried about those long-term, especially at this point in time, job-related, money-related, family-related, health-related, all of those things that go on for a long period of time can impact your blood sugars. So when we're stressed, good or bad stress, our blood sugar levels rise. So what happens is we have two stress hormones in the body. One's epinephrine and one's cortisol. And what those are sort of produced when we have that fight or flight mechanism. So we've really got to figure this out. We've got it. We're stressed. We've got to find a way to change what's going on and make it better. So we have more epinephrine and more cortisol in our bloodstream floating around. And when that happens, a couple things happen. So cortisol will raise our blood sugars, and somebody who is not diabetic and sugars are considered normal or below target, we have ways to control that blood sugar. But somebody whose sugars are already elevated, somebody whose sugars are higher than normal, has less control over those blood sugar increases. So they have more difficulty bringing those sugars back down to normal or back down to target. And the longer the stress occurs, the more likely we're increasing the risk of damage or complications in the body. And that's the concern we're looking at. So what do we do about stress? We probably all have different things that we do about stress. We have to care for our body, but we have to care for our mind as well. So we do have services provided here through our family health team. And again, on the website, we have a number of programs that are available, both individual and group supports that are available. They run at different times throughout the year. So calling our main number may be a good way to get sort of the information of when a group is running, because right now everything's kind of on hold, unfortunately, with coronavirus the way it is at this point in time. So what we would suggest is an intake appointment or an intake assessment is what we do as a first step to help you get the services that are most important for you. So how that is done is you'll be triaged to see Lauren, one of our allied staff here, for an intake assessment. And those can be done right now by phone. So you would call our number at 519-273-7017. It is best if you can get a doctor referral to then come and meet with Lauren. And what she's going to do is give you information on what is available both here at the Family Health Team and in the community for you to be part of. So that's basically everything I'm going to talk about. I am going to just go over some of the next steps, and then Kim will do her nutrition portion of this program. So what can I do next? So next steps are once we get back up and open and running, you can book a one-on-one appointment with any of the allied service providers here at the Stratford Family Health Team. So myself, the pharmacist, for medication, for blood sugar monitoring, Kim for your nutritional needs. We also have the nurses that help with smoking cessation. We have physiotherapy as well in case you need some sort of a modified activity plan. We have nurses who do healthy heart presentations, blood pressure checks, cardiovascular risk reduction. So again, everything on our website, and on this slide, it is at www.sfht.on.ca, has all of our information, or calling our support staff at 519-273-7017. That as well, they can give you the information. What I would like everybody to do is make sure they're following up with their doctor as the doctor has asked for follow-up appointments, and also having their blood checked regularly. So for most people with an A1C 6.5 or above, the doctor's going to want to check that every 3 months. It's probably also going to check your creatinine, which is your kidney function. Again, we're worried about that kidney function. We want to make sure it's functioning properly. People with an A1C of 6.4 6 to 6.4 in that range, the doctor may want to check it every 6 months. And for anybody who's A1C is under 6, we're looking probably a year, depending on what other comorbid conditions you have. But make sure you're checking with your doctor and knowing when that should be done, and just mark it on the calendar so you do that. I've also put the Diabetic Education Center website, which is at the Stratford General Hospital. They are very helpful with insulin adjustment, insulin starts, insulin titration. That's probably where the doctor will send you if they decide to start on insulin. And then I've also put the Canadian Diabetes website. A lot of information on there. It takes a bit of time to navigate. Recipes as well if people are looking for some of that in the meantime. So again, thank you so much everybody for being a part of this presentation. I hope it was informative. I hope it was helpful. But no, I am a phone call or an email away. So again, phone number is 519-273-7017. And my email is lmurray@sfht.on.ca. Thanks again, everybody, for joining with us today. Take care. Bye-bye.